editions of Reality Radio 101, its advertisers and sponsors, or its listening audience. Listener discretion is advised. Good afternoon and welcome to the Liquid Green Health Show with your hosts Fred and Janet Cox right here on Reality Radio 101. To get on board, send us an email. Our email address is liquidgreenhealthshow@gmail.com. And now, ladies and gentlemen, right to your hosts of the Liquid Green Health Show, Fred and Janet Cox.
And good afternoon, and welcome to the Liquid Green Health Show. A warm welcome to all our listeners and viewers tuning in across Canada, the United States, and other regions around the globe. We are the Coxes, and we're excited to have you with us. So please sit back, relax, and get comfortable as we guide you through another hour of edutainment designed to inspire and energize your journey toward a vibrant, healthier lifestyle. You like that?
Yes.
Wasn't that good?
Well, not too bad. Not too bad at all. Although you sounded as if you were out of breath.
Yeah, I was. I was out of breath.
If you're doing your exercises, But we're going to talk about that today. We're going to talk about that today. Okay.
We love your comments, folks. So please keep those comments flowing to Liquid Green Health Show at gmail.com. That's Liquid Green Health Show at gmail.com, and let us know where you're tuning in from. Today, we have an exciting topic and a wonderful guest. We're going to be talking about something that is causing, or it causes a lot of health issues every year, right? And it's hypertension. It's often referred to as high blood pressure. It is a silent but very serious condition that affects an estimated 1.3 billion people worldwide. Could you imagine that? 1.3 billion people. And it kills approximately 10 million people every year. So this is a very, very interesting topic. And if you're listening to us and you have a friend, you want to call them, do so, give them a call, tell them that the Liquid Green Health Show is on. All right. You want to say something before we go?
Well, in terms of introducing our guest, it's okay. I'll let you go ahead.
Let me go. Our guest this evening is Raveena. Our guest this evening is Raveena Rajasingham, a highly accomplished professional and someone who can really explain to our listeners and viewers what exactly is hypertension and what we can do to avoid it. She is a national cardiology, clinical, and device specialist for Spacelabs Healthcare, a special lecturer for the Faculty of Health Disciplines in Athabasca University, and holds degrees from various universities in nursing and healthcare leadership management, cardiovascular studies, applied health sciences, and has a master's degree in health studies specializing in hypertension measurement and management. And I'm going to let her explain what that is.
Right, because we missed out some of those universities. Like, you can elaborate. We want people to know exactly who you are and why we're so happy that you're here, because you travel a lot and you specialize and you're working on the masters. And so we feel as if we have someone who is, you're not a doctor, but you're super qualified. None of us are doctors, actually, but we like to do the research. And when we bring somebody on who can help to clarify in layman's terms exactly what the topic is all about.
Right. And throughout the years, she has published research articles, presented abstracts at Canadian and American hypertension conferences, and she is currently working towards her PhD in hypertension. Raveena is very committed to her community and passionately promotes youth, diversity, and social justice. She's also a community wellness and health seminar presenter, sharing her expertise and knowledge with others.
And before you start, at the very end, we're going to talk about something else that you're doing that is so exciting.
Multi-talented young lady.
We're going to leave that to the end, right? Because I think that's pretty amazing. So we're really happy to have you, and welcome to the Liquid Green Health
Welcome
Show.
to the Liquid Green Health Show.
Have we missed anything about you that you would like to share before we start with a question about what is hypertension and why is it the silent killer?
Sure. I think you've got, thank you so much. First, my thanks to you, both of you, and the Liquid Green Health Show for having me on your show. I'm so honored, and it's a great platform for me to talk about hypertension, which is dear to my heart, and spread the, information out. And that's what I wanted to do. So here I am. Thanks again for having me. And I think you did a pretty good job. I know it's a hefty little portfolio I have there, or things that I've done, but just, you covered it well. And I'm all about the community. I know I have a professional job. I do academic research work as well, and I continue to do so. And I think it's very important to continue to do that, as well as I think giving back to the community, and you covered it there, is do health seminars to all sorts of different communities out there, doing health seminars, especially specifically blood pressure. And now I'm asked to be on the board for Hypertension Canada, for an advisory board, I think, coming up with the guidelines for GPs and patients about blood pressure measurement. So it's an honor for me there. But it's all about the people. And I do a lot of community work as well. I know we could talk about that later, if anything, I'm part of the Legion as a youth education chair. These are volunteer things, and I'm all really dedicated to science. So I've initiated the Durham Regional, the science fair for Ajax and Pickering, our local library, public library science fair. Those are some of them. And of course, giving back to the community in so many different ways, in the food banks, tree planting, and all the other things. They're just my passion, to do. So I think you've covered it all.
Are you married with children?
Yes, I am married with children. Yes, I have 3 children, actually. My eldest daughter is 18, and my second daughter is 16. My son is 10 years old, who's going to be 10 next week, actually. So, the beautiful family and my husband are very supportive, and, with my busy schedule, they're all with me. And so
that's great. Okay. All right. So we can, are we okay with the picture there?
Yeah, it's okay. Yeah.
Okay, good. I'm going to start by saying, I'm going to let you do most of the talking, because you know exactly what what we want to talk about. But in the little research I did, one of the doctors was saying, he said, like, hypertension is really nothing on its own. So what? You have high blood pressure, but it has to be related to something. And so I don't know if that's enough to get you started, because it's going to relate to a whole realm of other issues. So tell us, first of all, what is hypertension and why is it called the silent killer?
Right. So I'll start with, first I'll go in an order so the viewers and audience could understand. So you have a normal blood pressure, right? So which is that it said as 120/80, which is your normal blood pressure, which what that means is sends bloods to each part of your body in a not complicated way, carries your bloods to your organs like your brain and kidney, and then you have and also pushes blood through your arteries without any stress, and pushes blood without any hurting any of your walls, your arteries, or anything, none of it. So that's your normal blood pressure. What is high blood pressure, and why is it a silent killer? We usually say it's a silent killer because you don't feel it. You wouldn't know until you do the testing. There's some people who feel a little bit of, a head numbing, or back of your head's hurting, or hands hurting a little bit, arms hurting a little bit. But most of the people don't feel it. That's why you call it a silent killer until you go and do your blood pressure checkups, right? So that's why that's called. So now we have high blood pressure. So what does that mean? High blood pressure is the force of blood that goes pumps through from the heart against the walls, right, of your heart wall. So this force makes the blood to flow, which is possible everywhere, and delivers nutrients and oxygen and so forth to your rest of your body. So high blood pressure happens when there's too much pressure in those blood vessels. So what that means is it can damage your blood vessels and cause health problems, obviously. So you have two numbers, which is 120 over 80. So 120 is we call it a systolic number, where your blood is at the highest pressure there. So it's just about to pump out the blood from your heart, and it's collected all the blood, it's just ready to pump out. And so that is your 120. That should be the normal range, the normal value there. And then you've got your 80, which your heart's relaxing, it's filling up your a vessel with a lot of blood. So that's 80. So either one of those is higher, then you've got a problem. So you've got a problem. So what are the problems? Why is there a problem? How does that happen?
Before you go into the problems, I want you to explain to our audience. We have a wide audience, a mixed audience. You say 120 over 80 is normal, but normal is relative, correct? Because
Correct.
if you're older, it's higher. If you're a different race, I think Caucasians, I was hearing Caucasians can get away with 140 over 85, 90, and that's still considered okay. Where somebody who is
for a Black person,
would be having a stroke at that point.
Right.
So could you explain why is it that it's different? Or is that a factor that you look at when you talk with people?
Yeah, so so we have the norm that is for a regular person or who is just, the 120 over 80. But then you've got people with high risk of heart disease where your aim is to get it lower 120 because you've got issues and we need to make sure your blood pressure is good. Then you've got, for example, a special target for those with diabetes. So for example, it has to be less than 130 millimeters and 130 over 90. So every person, or I would say, maybe individual has their own blood pressure, depending on what they have, the underlying issues like other problems, right? So for example, somebody for most target blood pressure for most people is 140 over 90, right? Some people. So, but we say, let's aim for 120 over 80. That is the main, but then everybody has their own different criteria. So nobody's like the general number, but then everybody has their own, depending on what their underlying treatment they're going through or other diseases they may have.
Okay. And could you clarify something for me? This is for my own edification.
Sure.
I don't know if anybody else out there wants to know this. But when you go and you take your blood pressure, Frederick, we've seen this. You take it the first time and it's like, whoa, it's high. And then you wait 2 minutes or a minute and it goes right back down to where it should be. Why does it fluctuate so much between the first time you take it and the second or third time you take it?
Yes, that's a common problem that a lot of people have. So that's a great point. So first I'll answer your question there. So as soon as you walk into the doctor's office, right? You might be going through your running from work to your office or to the doctor's office to get the blood pressure or the stress there. You might be going through a stress that stressful day that day itself. So you need something to calm yourself down. So when you go to the doctors, they take the blood pressure right away. They actually make you sit down and then you take a couple of blood pressures and then it slowly goes on. So you're kind of, your mind and your body is kind of relaxing. But if you go right away and take your blood pressure, it is going to be very high.
Okay.
And that's why you take 3 minimum readings before you average those 3 readings, and then you have your right blood pressure. So that is leaning into one of my one of my sections that I wanted to talk about is a lot of people don't know it's something called white coat hypertension. So when you walk into the doctor's office, you look at the white coat and you're like, oh my goodness, I'm here and so tensed up. So that elevates or that increases your blood pressure. That symptoms or that phenomena is called white coat hypertension. So that's why sometimes you'll be asked to sit down for a few minutes and then let's take your number of your readings. But there is another one opposite to that is we call it masked hypertension, where your blood pressure is so perfect when you come to doctor's office, but during the day or during the time you're at home, maybe you're stressed or something else that's happening with you, your blood pressure is high, but sometimes you don't realize it that it's high, but you're trying to you think it's normal. So we've got two kinds. The masked kind is it's really not detectable. It's hard to detect unless you start getting some symptoms, right? So you've got two types of blood pressures there. So now I'm also going to go over what do we do, the measurements, how do we measure those or how do you make sure those?
Yes.
So then your earlier question, you also asked, why is it high for some people? So also age is a factor, right? Yes, the insult of take is important because that also alludes to having higher blood pressure, and genetics is another one. And of course, then you have your ethnic background. So like you said earlier, South Asian population has a higher, greater chance of having high blood pressure, and also Black population, especially women. So I did a presentation and show them how to measure and so forth. One of the church here in Pickering, and letting them know that Black woman has high blood pressure. So we said, okay, you really got to take care of that. Sorry, go ahead.
No. I was just saying
I'm
like one of
yeah.
one of those.
Oh, you're okay. Okay, sorry.
Glad you touched on that. Where you talk about the differences between the ethnic groups. Is there a specific reason other than
Epigenetics,
diets and stuff like that, or is it just genetic disposition?
Genetic disposition and their lifestyle, what they eat. They're high in salt intake, and because also the salt is not dispersed through the body, or it does not get through the body. So it's again genetics at the same time as their lifestyle.
Okay.
But then you have people like a lot of South Asian folks are what you call it? They're
Vegetarians. Yeah.
And then you still see the high blood pressure. So I guess in that case, it as you say, it's going to be
lifestyle,
not lifestyle, because being vegetarian is good.
Could be.
It would be more genetics, correct?
Genetics, and could be the South Asian maybe putting in a lot of salt in their food, right? So it could be that. And also, as you age, your blood vessels becomes a little stiff.
Right.
So when it's stiff, it adds a lot more pressure, right? So that as you're aging, it's normal to have higher blood pressure. But the important thing is that patients or anybody should be really talking to the physicians and saying, okay, what can I do? Or start your preventative measures from early in advance and say, okay, I'm going to check my blood pressure on a regular basis, or I'm going to be really controlling my diet, or I'm going to be really controlling my salt intake. All those, and exercise daily. Walking helps a lot, exercise daily. So those are the little preventative measures. But in the norm, where as you get older, you are prone to have high blood pressure, and they will treat you like a small dose of maintenance drugs and whatnot.
So what about age? Like for kids, well, young people then in their 30s. Now we're seeing that younger people are getting some of the diseases back then, where it used to be some things that you used to get at 80, people are getting at 60. What you used to get at 60, they're getting at 40. What age should somebody really start checking their blood pressure? Seeing the way things are changing, should they be in their 30s, 40s? When is it become important? Is there something?
There's no cutoff to check the blood pressure. However, I would say even starting as mid-20s, because everybody's lifestyle is very stressful these days. A lot of environmental factors, they're all busy running, working, and a lot of things going on in their life. So that could add to that. So I would say even if they see small symptoms, is just a little dizziness, something, you just need to have your blood pressure checked out. And on a regular basis, do your testing with doctors as you go to doctor's offices, on your regular basis, do your physical on a regular basis. And that will allow you to identify whether your blood have hypertension or not. Or sometimes hypotension, so low blood pressure, can also be harmful as well. People don't realize that some people have lower blood pressure. It becomes symptomatic where they feel really dizzy. They cannot continue with your daily life. That could also be hard or not good as well. So those things.
Could you explain?
That's worse than the other.
Yeah, that's what I was about to ask. Yeah, yeah.
Would you prefer to have low blood pressure or high blood pressure? Would one kill you faster, in other words?
Right. So it depends on how low you go.
Okay.
Some people go, if it goes really, really low. Again, another point, I'll finish this one. I'll come back to my next point. So if it's really, really low, of course, you could go easily into coma, right? Because you're not getting enough blood into your brain. Oxygen. So, and some people are managing with a lower blood pressure. It's just their normal blood pressure. That's what it is. Long as they don't feel asymptomatic, they're monitoring their blood pressures throughout, then they're fine. But somebody who is higher, very high, they could be really, again, stroke on a very end of spectrum there, like around 170 whatnot. That could be all of a sudden, that pressure could break some of the vessels, and the smaller vessels, it could also break. You could, tear your eye vessels inside your eyes as well. So those are harmful. So there is no clear cut is how low can you go. We usually looked at the symptoms as well, but you will feel if you're low, you're just getting dizzy and so forth. You just can't get up because you're not getting enough blood flow into your head or rest of your organs, right? So you'll feel it, but there is no how you're going to really get sick. It depends on the person too. But as soon as you feel some sort of a symptom on your regular, you should have a regular checkup to make sure. Other thing that I would really suggest is, so we've got your blood pressure. So for the children is even lower. There's a different blood pressure for children, adolescent versus adults. So just don't get panicking if a child has a lower blood pressure and goes, oh my goodness, is really low. But they all have a different blood pressure. Again, consult with your physician to know, especially if you're feeling something. So my next point is, so you all know, what's going to happen if you have a high blood pressure, right? You could you could get stroke, you could have a heart attack, eye problem, dementia, you could have a kidney failure, heart failure, or renal disease, even erectile dysfunction if you have a high blood pressure, if you don't control it. But you could also control some of it you cannot control, right? So what can you control? Your lifestyle. Obviously, you could control your lifestyle. You could control if somebody's smoking, you could control that. Excessive alcohol, there is a certain measurement. So hypertension, if you're in Canada or if you're in the US, some of the viewers, if you go under Hypertension Canada, it kind of gives you a lot of information about what to expect, what to do, and how you could maintain or how to measure and so forth. It's a great the website they have there for Canadians. And you could also go into,
What's
if you're
called? Which one is that?
Hypertension Canada.
Oh, okay.
Right. Yes. So they're the one who come up with guidelines for across the country. They're involved in a lot of the research studies and so forth. And we've got a lot of leaders in hypertension in that organization. So if they could look it up. And then for the US viewers, you could also look into Hypertension USA, or I think they used to have American Hypertension Society in the past. So I think they might redirect you, but you could certainly look at that as well for the US viewers. So make sure, and they give you a lot of details. So now, so we were talking about excessive alcohol because that's why it kind of alluded that they specifically say what's too much. You've got your norm about how much you could take intake of alcohol, and the stress also could obviously lead to hypertension, diabetes, sleep apnea, meaning if you don't have enough sleep, that could help, that could allude to or contribute to hypertension. Unhealthy diet, obviously we all know unhealthy diet, obesity, so the overweight, It could also lead to hypertension as well. And
Before
then
you,
also,
before you go on, unhealthy diet. There are two culprits, sugar and salt. Is one worse than the other, or are they both pretty bad when it comes to hypertension?
when it comes to hypertension, it's a salt.
Not,
But
not
It's a salt.
is it the salt or the amount of sodium in the salt?
Amount of sodium in the salt, which is in the salt.
Is in the salt. Okay.
That's correct. Yes.
So for people who eat a lot of the processed food and if you're not doing so great with those things, as long as you control your salt intake,
Right.
is that not still a problem because of the sugar? No?
Yeah, no, sugar is there, yes, but mostly salt. Sugar will contribute to diabetes, right? So,
Okay,
but
that's what
salt,
diabetes.
that's right. Sugar will contribute to diabetes, but salt is specifically is I mean, sugar will in turn cause blood pressure, but in a more of a indirect way. However, salt is the one that contributes heavily towards hypertension. So the processed food, I mean, with home cooked food, with vegetables, and when you say, when you have the diet at home with home cooked food, is great because you know how much salt you're putting in and so forth. But if you're having everyday processed food, a box food,
Mm-hmm.
you think, oh, look, I got my vegetable here, I got this here. But you got to think, because those processed food, in order to keep it, I guess fresh, or not fresh, I should say, maybe
Long shelf life.
long shelf life, they will add chemicals and also salt and so forth. So people say, oh, look, I got my plate full of vegetables and I'm eating healthy here, but not really, because you got to think what they've put in there. So I would say, it's great point you brought out about the diet, is you need to it's better for you to cook at home. And also, and then how much salt you're putting in. You could cut it down and so forth.
Okay.
Now, I want to ask you about hereditary conditions.
We talked about
We did?
yeah, okay, go ahead.
Yeah.
Again.
A lot of people will say, well, blood pressure runs in my family, right? And there isn't much that I can do about it. I wanted to address that. Like,
Right.
how do people who know that this condition runs in the family, what should they do?
Right. Because
So,
because your folks have it means
It
you
means
have
you
to
should
have
you
it,
should
right? Yeah.
yes, absolutely. And I say, yes, I absolutely hear you on that, because people say, well, what's runs in my family, I'm going to get it anyways.
Right.
Well, you could prolong that getting it. Yes, you have it in your genes, but you could prolong that. How do you prolong that? Being very actively taking care of yourself. So, which means the diet, low intake of salt, exercise on a regular basis. That's the best thing. Walking, exercise on a regular basis. I know you cannot have a really stress-free life, but try to calm yourself. Sometimes yoga, those kind of meditation helps a lot. So those would be, I would say, is to do. But don't say, oh, well, I'm hereditary, or it's in my genes, I'm gonna have it, it doesn't matter, I'm gonna eat whatever I want. But no, you could certainly prolong that. And some people do, and some people have it, your mom, dad, everybody has it. But then, you know what? They've been so careful that they've prolonged their time of getting high blood pressure. So, and that is a message.
And when it comes to gender, who's more prone? Are males more prone than female?
Well, she's mentioned that Black women are more prone than Black men. What about the
But
other
right
folks?
across the board, yeah.
Across the board, I think they're pretty much the same, I think. But I think, don't quote me on this, but I'm just trying to look at back, because every study says something different sometimes. But I would say men would have a more higher blood pressure than female, but don't quote me on that. But in terms of, I know certain population, like is it Black population, female are more common, has high blood pressure. South Asian, it doesn't matter, men and women, they're both the same. But in general, overall, I would say it maybe male, because sometimes certain lifestyle.
Plus, they drink more beer.
You're right. That's
Okay.
right.
All right.
So,
So you want to check some emails
Yeah,
and just do a
let me
station
do that.
ID, and then we'll come back
Yeah,
with
you
some
want
other
to pull it
questions?
up in the meantime.
So
Just stay put. We'll be back with you in a minute. Folks, you are listening to the Liquid Green Health Show with the Coxes. You can catch us live on YouTube, or you can listen to us on Spotify as well. And don't forget, if you are watching us on YouTube, please hit that like, subscribe button, and leave a comment. We'd like to know what you think about the broadcast. Okay. We're also, today we are streaming live on Reality Radio 101, and all episodes, as I mentioned earlier, are available on YouTube and Spotify. So that's it for now. You got any emails there? There you go.
Actually, remind us when we come back. We want to talk about the things that people we did talk about quite a few of the things we should do, but we want to discuss something about the medications as well. All right, Raveena, when we
I think I want to also talk about, I think this would be important for the viewers, is the measurement types.
Yes.
How do you measure?
Okay.
Yes, I think I want to cover that piece as well.
Great.
Okay, so let's get to some email and then we'll get back. You want to start?
Okay, with Kim. Kim says, oh, wow, 9 of us will be listening today, Coxes, all with high blood pressure. Make it good. This is Kimberly.
Well,
so, Kim, I hope you are listening.
And I hope you're taking notes, not just listening, because this is a very important topic.
And I hope you're also not eating some of those foods,
high salted foods, yes,
and stuff, right?
They taste good.
Okay, thank you. And Anne says, Cox family, there's so many ways now for folks to check their blood pressure.
Okay, and we're going to let our guests explain that.
Address that right now,
Yeah.
so that we don't forget.
Yeah.
What are some of the ways that we should check? I know you wanted to talk about that. Probably we could do it right now then.
Yeah.
Absolutely. So this is my expertise in this area. So I'm excited to talk about the different, so we've got 4 methods. First method is, we call it office blood pressure. So which means you go to the office and doctor takes 3 blood pressure measurements, averages it out and so forth. That's one way. The second way is, we say office ambulatory blood pressure measurements. So I don't know if some of you had that experience where you kind of go they'll take you to a room and you kind of sit down and put your arms out, and the machine will automatically take 5 readings or 6 readings throughout the intervals of 5 minutes or 15 minutes. So that's called office ambulatory blood pressure. So that's kind of helping with the white coat hypertension to see, okay, what is your actual blood pressure. So that's your second one. The third one we have is home blood pressure monitoring, which is the one you could do at home, which means that you buy a Hypertension Canada recommended blood pressure monitor, where you could also buy it from your drugstore, your pharmacies, and you have it with you at home. This is what I would say is the best thing that you could do, and best investment for yourself in terms of guiding you through or letting you know if you have blood pressure or not throughout the years. So is to buy and have a monitor. You could check 1 in the morning or in the afternoon, 3 times a day or 2 times a day. That will kind of give you, okay, what your blood pressure is. Those who are taking medication, they should do it every time before they take the medication. They should do a blood pressure and then take the medication, maybe then during lunchtime also. And so 3 times is good. When you do I'm going to focus a bit more on the home blood pressure monitoring, because sometimes people don't do it correctly. And it's very important that you're very consistent in how you measure. So what I mean by consistent is, when you measure every day, is just, try to be in the same spot and put your arms out to your heart length, or this same angle as your heart. That's correct. And then put your cuff, the size of the cuff. So don't put a large cuff into a small arm, or a small cuff into a large arm. Cuff size is very important, because they could change your blood pressure measurement by 3 or 4 millimeters per mercury, which is not accurate. So cuff size is important. And when you're taking the blood pressure measurements, please do sit still. Don't talk on the phone or worry about other things. Just sit in a chair. put your arms out and do the blood pressure measurement and do about 3 or 4 and average them out. So for your first one, I bet you any money, it will be high. The second one, as you go through, your second and third one will be lower. So you take an average of 3, and then your doctor will love you for that, because then you could have a little chart with you and you could write it down, says, okay, you took the blood pressure, whether you were taking a pill or, whatever it is. And then you take a chart and you go, okay, yeah, that's good. And then you could present that to your physician.
Actually,
So
my doctor gave me a chart to take, which is great. And I thought, whoa, at least it gets you in the habit of trying to take it. And before you move on to the last one, what about lying down? Is that okay if you lie down to take it? Or if you lie down, should you be lying down all the time? Or if you're seated, you should be sitting all the time you do it?
That's right. So what we recommend, or Hypertension Canada recommends, is when you're taking the blood pressure, if for some reason somebody can get up on their back, totally understandable. If they're lying and taking blood pressure, you should lie and take blood pressure every day, like consistently, if you can. The reason for that is because there's a pressure difference as you're supine or when you're lying down versus when you're sitting up. So when we're doing sitting up, we say feet flat on the floor and arms out, and then take the blood pressure, don't talk, and then there you go. So it is important, and jot it down whether you are lying down or we are sitting up, because that makes a difference. So
now, before you continue, sorry to interrupt. You mentioned the cup size. It should be just the right size, not too large, not too small. Once it's on your arm, should it be tight or just loose?
So we usually say it's not too tight, not too loose. We should be able to put 2 of your fingers in the cuff like this, and see. And if it's too tight, or if it's too tight, you can't really put your fingers in. If it's too loose, it's going to come off. So just enough that you could put your 2 fingers in there, and then see that's there that you could do. The other one is all the monitors cuff has a little size, centimeters on them. So if you wanted to first measure the circumference around your arms, and say, okay, that is in centimeters, and I go, okay, yeah, this cuff fits me. So you could do that check as well to make sure that's done. And those are the things that I say look out for when you're doing it at home. And I really applaud for those people who are doing blood pressures at home, because that's just you taking care of your body and yourself. Because when you go to the doctor's office, they wouldn't know what your blood pressure is at home. So this will give them some sort of an idea as to what the blood pressure is.
Okay. So thank you for that. And I'm sure
the last one.
Oh, sorry, you have one more, right?
Yeah, one more. One more is a big one. It's a big one, meaning it's only prescribed by the physician or GP or your family physician or your cardiologist. That is the one, we call it a gold standard measurement, which we call it ambulatory blood pressure monitoring. So the patient would have this monitor on for 24 hours throughout the day, or 24 hours, and it will take measurements. They program it to take it every 15 minutes or every 30 minutes during the daytime, and at nighttime every 1 hour. So what that happens is it's just continuously taking your blood pressure and recording it. Once you've taken out, that's for the 24-hour period, you wear it throughout. You don't take a shower or anything like that, but you just wear it for 24. When you take it out, that is the best information a physician could have. So what it gives you is it gives you your daytime average, it gives you the nighttime average, and it gives you the overall averages. So that is very comprehensive report right there for you. So during nighttime, your blood pressure is supposed to be going down. So when your blood pressure is high at nighttime, there's something wrong. So we call it an nocturnal dip, which means at nighttime your blood pressure is supposed to go down. And during the daytime, you say, "Well, I'm white coat hypertension." So sometimes they put on this blood pressure monitor as well. So we could monitor your blood pressure throughout the day and see how is it behaving. So if your overall average is within that little range of, that little window of, well, let's say 135 or 85 or that window, and then we're looking good. But if your blood pressure is really high, then we've got a problem. Then we could be on your medication. We call it a gold standard. However, it's a little caveat to that. That particular service, when even it's prescribed, is not covered by our OHIP. here in Canada, meaning in Ontario. But in one province, this is covered, but rest of the provinces, not really. So patients have to put it out from their pocket, like the $50. It ranges from $50 to about $100, depending where you take the measurements or the way you take the test. So people have to go and do that, and it's prescribed or asked by the doctor. Go ahead. Yeah.
So a question for you then.
Sure.
That's the four. What about the people who don't do it at home? But I know a lot of people go to the stores, to the pharmacy,
Yes.
and they'd sit and are those reliable at all, or should you just spend the money and get the one at home and forget about the store ones?
It's no, store ones are good because I think they're calibrated.
Mm-hmm.
A lot of the stores are calibrated, which means they make sure you test the right blood pressure is, is giving in output. So if you cannot afford to have one at home, that's why the drugstores have the blood pressure. So make sure you go and take it. If you have the time, go and take it, but make sure you do 3 measurements and then average it out. So yes, that's a great point you brought up, because I had in my mind to say that, but it slipped my mind. I'm so glad that you brought that up, because those people who cannot, afford that blood pressure monitor at home, a home blood pressure monitor, this is a one way for them to go and take their blood pressure.
Okay, so we have another email from Walt, and Walt said, Cox says, another great topic today. High blood pressure is the silent killer. I know, because I had a stroke because of it. And I think, oh my goodness, Walt, I'm so sorry to hear that.
Yeah.
And from what we hear, stroke is one of the things that when you get it, it's one of the most difficult things
Devastating.
to come back.
Yeah. Come back
to
from.
normal from.
Yeah.
Is that true, by the way?
Yes. So is it Mr. Waltz?
Walt,
Walt,
yes.
Yeah. So I could completely agree with him, because my own mom had 14 years ago, she had a stroke because of her blood pressure was very high. And until today, we're dealing with it because the stroke happened in a very specific area where she just feels like, there's a blood dripping down, but there isn't. So there's just like, we can't do anything anymore for that treatment, or we can't do that. We can't get any further treatment for her, but she just have to go with what she has. So it is so important, because stroke can, if your blood pressure is high, all the right reasons are in there, and it could just break some of your blood, in your blood vessels in your brain there, and that's going to cause your stroke. So that's why it's important to make sure that you take care of blood pressure.
Okay. And thank you. Tina says Fred was out of breath at the beginning of the show. I guess I shouldn't tease you, right? What's his blood pressure? As a matter of fact, Tina, this gentleman has much better. He's never off, right?
Yeah.
Your blood pressure is always great, and mine is usually challenging. No, I have like a thyroid situation going on for years. Does things like hyperthyroidism, is that one of the things that will affect your blood pressure?
Thyroid is, you're looking at different things, right? So it may and it may not. Most part it may not. But again, monitor, because once you start getting your medication, you should start monitoring. So I don't think it'll affect, because you're looking at, that's different. You're looking at the hormone section of it. So so it's different. However, one leads to another. You never know. So again, you start getting into the habit of monitoring, right? So another thing I wanted to just to say this is if you are taking blood pressure medication, don't think that all the blood pressure medication that you have will be, it's going to be perfect for you, it's working for you. Always take the measurements, and sometimes it doesn't work for everybody. That particular medication may not work for that person. So I did a study for 600 people in one of the labs, and we were looking at their blood pressure and seeing, okay, if their blood pressure is controlled, they've taken the medication, are they controlled? We came back with the study showing that about 72% of the people whose medications were what they were on medication for high blood pressure was not controlled.
Really?
So yes, we have that situation as well. So don't think, oh yeah, blood pressure is here. I'm taking the medication, I'm going to be fine. Just monitor yourself and make sure your actual blood pressure is working. Or they may even bring it down really low that you're feeling all the symptoms. So it's important, again, when you take a new drug or new medication, make sure it's right for you.
Okay, another question I want to ask you before I go back to the emails, and these are coming to me as I'm talking to you,
Sure.
is like so many times we're holistic people. We're, homeopathic. We want to do things naturally, right?
Yes.
So I think blood pressure. I mean, there's so many things. We know about the garlic and the ginger and all the other things we should be taking to help
the lower blood pressure.
Blood pressure. But when I think of a stroke, and again, my mom, like your mom, she didn't get a stroke, but she had vascular dementia, because of blood pressure and the brain, right? Blood vessels going off in the brain. So should we try to get on the doctor medication and then try to wean yourself off? I know I said before we're not doctors, or should people just say, what the heck, it's too much to risk. Let me just stay on this medication.
Also, there could be side effects.
And the side effects, because of side effects, etc. What do you say? And I know you're telling us an opinion. You're not giving anybody instructions, right?
Yes, these are just opinions that I have based on what I've learned from others. So soon as the doctor says, okay, you're borderline of blood pressure, take care of it before I put you on medication. I'll give you a week or a month or whatnot. Let's see, he could bring it down. So you go back and say, I'm going to change my lifestyle. I'm going to eat my garlic. I'm going to do this. I'm going to do that. Let's come back. Let's do your blood pressure measurement after 3 months. Okay, well, it's still high now. Okay, so what do you do? Well, you don't say, well, I'm going to go back and try again, because it's already at your high level right now. The more you leave it, the more damage it's going to cause you. So they put on the medication right away. That medication may not be the right one for you. You might have a lot of side effects and whatnot, but they might change your medication and so forth. So what I'm trying to suggest, or not to recommend to people, but I'm just saying what I've learned is people try to do the first initial piece is to see how they could lower it down or be proactive at the beginning. Once you're actually at a high blood pressure, sometimes you do need that medication to bring it down, because otherwise it won't go, and it's just too extreme. You need those medications. So we usually say, see it and how it goes. But if, and you start walking and you do exercise on a regular basis, you be a diet health, your diet is good and everything, and your blood pressure naturally is coming down, and they may see, okay, should we take it off you or take off the medication from you? Or maybe should we wean it down a little bit, bring it down a little bit? You don't need so much. So that is your physician and you to sort of decide, what they want to do with you. But certainly the initial piece is how it's done.
Right.
Yeah.
Okay.
But the whole idea is to keep it down,
Yes.
And we're running. I know I shouldn't always stress our listeners by talking about the time, but the time goes very quickly. Alexis says, what is normal blood pressure? But we talked about that. So I'm going to ask Alexis to go back to the show. I know you mentioned 120/80, but we had a little conversation about that. Go back and listen to the first part, right? Yeah. And Holly says, limit salt intake. And you talked about that. Great. Catherine, what does she say, Frederick?
Hello, Coxes. Excellent show today. This is a great topic.
Great. Thanks. And this really, everybody is affected by this, right? By blood pressure. This one, okay. Yes, Bob. I do the blood pressure monitoring. That looks like a nice one you sent. He sent a picture of one of the machines you were talking about that you could buy from the drugstore.
But he's also insinuating it's because I'm sitting next to you.
Why I have high blood pressure. Yes, I think so. Definitely. And then David says,
hi to Janet and Fred. Folks should check their blood pressure at least once, if not twice per day, and take an average reading. Mm-hmm. That is the best way to keep tabs on your blood pressure. And Raveena did alluded to that.
Raveena, our listeners it seems the industry is making an impact everybody seems to know what to do about blood pressure.
Yeah.
Here's another question, and this one is
this
from
Frank. Frank, and Frank says, "Hi, Liquid Green, herbal meds to help with blood pressure. Any recommendations on those?" You know what? We do have quite a few of supplements that we do talk about. But I think we should do a whole show. Yeah, we'll send him some information on that.
And we did talk about, just a minute ago, we talked about the garlic and some of those other ones, right?
Well, I'll send Frank some information on that as well.
And James says, Janet and Fred, warn your listeners not to use apps to take their blood pressure via their phones.
Yes.
That technology has not been proven yet. The user will get false readings. I work in the computer industry, and those apps are not real. Stay away from them.
And that's a very good comment. Any comment on that?
Yeah, just so there's so many blood pressure monitors out there.
The
apps and monitors, make sure they're validated. And like I said earlier, Hypertension Canada has some that they recommend because they go through these validation processes and make sure which one is good. They're looking for certain things that the company has done to create. So apps, I wouldn't because I wouldn't recommend.
Okay, so he has given us some good advice then.
Yeah.
And sorry, go ahead.
I was going to say, just, make sure it's, when you look at a blood pressure monitor or whatever the app, do some research. Has it been validated? Who has it been validated? Those are the things that you should be asking. It's wonderful. The viewers are really looking at how to, measure their blood pressure. But these are the great questions, or these are the great things that are coming out with it. Or think when you do before you get an app or something, is to make sure that these they're validated, and if the research has been done on people and so forth.
Okay, here's one more, and we'll go back to because I know you have something to say before we leave. So, hi, Liquid Green, how do prescription meds help control blood pressure? Perhaps you can you talk about what you wanted to talk about first, and we'll leave this for the end.
Sure. Okay. Actually, I can address that question now if that's okay.
Wonderful.
Yeah, go ahead.
Yeah, I could do that, no problem. So some people will get one tablet, right, to bring down their blood pressure. So sometimes it would be a low dose to bring it down. Some people will have multiple medications, so we call it a combination pill. So combination of maybe a water pill and a blood pressure. So some people have 3 different medications because your body is not adhering to bringing down that blood pressure. So they might have 3 different kinds of medication. One could be a water pill, one could be certain looking at one receptor, another could be certain attacking a beta blocker or something else that they may bring in. So those 3 will be probably working for you rather than the 2. That's why some people, you might say, well, how come I'm getting 3 same blood pressure medication? Are they both the same? No, it is because those 3 will be tackling your blood pressure in a different angle. In putting into late term is tackling your blood pressure in a different angle. So that's why you probably need tea. But what you need to do is you need to make sure that you do that regular blood pressure measurement to say you're not going too low, or if it's still working for you or not. So that is the important piece. So to go back to your question, just to recap, yes, you may get 1 or 2 or 3 pills. We call it a combination pill because they tackle a different sector of your.
Okay. So don't want to rush you, but we're rushing you.
No worries. This is wonderful. No, go ahead.
All the time I know we probably won't get you again because you're so busy. We had to wait for you to come on. So we want to get you to talk about you were going to address something you wanted to share with us, because we have just less than 10 minutes.
Yeah.
Sure. Okay. You mean my running, right? Is that what you meant?
No. You wanted to discuss. I forget exactly what you said. You wanted to talk about something with the blood pressure that you wanted to share.
Right. I think I've already talked about the most ones.
Okay. Probably came through with the questions.
Yes, I think so. Yeah, I think we pretty much covered it. Just to recap, We
Yeah.
covered about what a normal blood pressure is, and what normal blood pressure do. We always hear the word high blood pressure, and we talked about what high blood pressure is, and we talked about what 120 or that bigger or higher number versus the lower number, what they both mean. We talked about the different causes of blood pressure, and also how we could control and which ones we cannot control, and family history and age like that we cannot control. And what are the if you don't take care of your blood pressure, what are the implications you're going to have on you. And we talked about somebody who has I guess diabetes or heart or stroke. Well, how do they need to monitor? Because there's a different types of blood pressure. We call them targets. We kind of alluded that at the very beginning. Yes, 120 is the number. 120 over 80 is the number, but then we've got blood pressure targets for every section. Again, it's up to you. Like, it's you who need to go to the physicians, your own doctor, to know what you're on, what you feel, and so forth. You are the advocate for yourself. The doctor wouldn't come to your house and say, okay, well, you're doing this wrong, you're doing that right. But you have to tell them this is what's happening. And then sorry.
Go ahead.
And we talked about the two types of blood pressure is the white coat and the masked hypertension. And the types of measurement, we talked about the 4 types of measurement and why it's so important to do your measurements accurately. And that gives you accurate blood pressure measurement or number that you may want to call.
I have one last question. Do you have one last one too? I know we don't have a lot of time, but
Right, we got to be quick.
We're so involved right now with AI, everything. AI is making so many grounds with medicine. The biggest gains, I think, is medicine, more than ChatGPT and movies and stuff, right? Do you have anything on the horizon? Any miracle thing that, if for those of us who probably had a stroke or the blood pressure, is there anything that you know of that is on the horizon that we're saying, yay, this is going to help to beat it?
Yeah, it's there's always technologies, right?
Yes.
There's Bluetooth technologies to blood pressure measurements. Like when it's done at home, it automatically comes into doctor's office, and then they'll say, oh, your blood pressure is high, you need to go to the doctor, or you need to go to the hospital emergency, or you need to come here. So it's always that technology is there. AI is there too, and I'm sure I've heard a few, but I can't really mention because they're probably in the work still.
Okay.
But there's always new technology coming out, especially the Bluetooth one is as soon as you take a blood pressure, it goes to your office. I think it's already out there, but it's just coming out. And you're doing more, I guess, work on how to, to control how to measure, and also how to keep tab of your blood pressure and controlling it. So that's.
Now we have 1 minute to talk about at the beginning of the show, folks, we talked about Raveena and how so many things she's involved with. And you're running in Canada. This is a very important job politically. Just tell us very quickly what it is you're running for in Canada.
You got 30 seconds.
Okay, I'm running for nomination for Conservative Party of Canada. I know you probably wonder why in healthcare sector I'm going into politics, because I see out there everything, and I want to it's a service I feel, and I want to make a change. I want to make a difference in people's lives when I go to Ottawa. So here is in Canada's Ottawa. So I'm member of parliament for going to Ottawa, federal position. But the first piece is the nomination piece. So first is the candidate. I have to become a candidate, official candidate of the Conservative Party, and then go. And it's usually done by memberships. So people would say, okay, yeah, she's wonderful. I'm going to sign up. And when the time comes to vote for, which is going to happen the next few, maybe within a month, and I'm going to vote for her. So that's becoming a nominated. Once it's nominated, when I'm nominated, and I become a candidate, and I'll be running for the Conservative Party of Canada, and then I become an MP, where I could do a lot more. I could bring my expertise into health.
Happy that you took the time out to come on the Liquid Green.
We don't know if we will ever be able to catch you again because we're busy. Yeah.
Have any time to check us out. So,
right.
And I wish you all the best for that. So, Frederick.
And thank you very much for, gracing our show, folks. At this point in time, we have to end, unfortunately, but we always leave with a wonderful quote that goes something like this: good health is the cornerstone of human happiness and well-being. It not only enhances your quality of life, but also drives prosperity and economic progress. Healthy individuals tend to be more productive and may even live a little bit longer lives. So until next Sunday, same time, same station. Go ahead.
Gary, I just wanted to say our guest's name again for people who did not get it. It's Raveena
Rajasingham.
Right. Okay, good. So,
Thank you.
Janet,
Thank you so much.
great. So, Janet and Fred saying,
Let's stay healthy on Reality Radio 101.
Thank you for listening to the Liquid Green Health Show with your hosts Fred and Janet Cox right here on Reality Radio 101.